Good morning.
Good morning.
Thank you for coming. I gather that you wanted to explore the option of PRP for incontinence.
I do, yes,
Right,
very much
okay.
so.
And I also gather that you've had the UV laser.
I have.
Yes.
I had 3 sessions.
Right, good, good.
Worked very well.
Yeah, and it worked very well.
It did, yes.
Yes, that's good, that's good. And you still have incontinence?
I do
or-
still have a problem with leakage now.
Right,
That's all. The stress incontinence, etc., is fine. I can cough, sneeze, laugh, but I still get that leak.
Okay. Now, when you say you still get the leak, is it mainly when you are about to rush to the toilet, or are you able to hold it on for a little while?
No, I can't hold it. So first thing in the morning when I step out of bed,
Mm.
it just runs out of me.
Right, okay.
That's the problem.
Okay. And do you still leak urine when you cough or sneeze?
No,
No, okay. Right, okay. And that is settled with the new laser?
it has, yes.
That's fantastic.
Mm.
That's good. Right. Okay. So, as you know, PRP is platelet-rich plasma.
It, yeah.
The blood has got 3 components, the white blood cells, the red blood cells, and the platelets. What we do is we use a tube we take blood, we put the blood in the tube, it's all a sterile environment, and then we put the tube into the centrifuge, and we run the machine, and this is how the tube looks like. So you've got the tube which has got a gel and a bit of anticoagulant here, and this also has got a bit of a hyaluronic acid. It is a kind of a natural hyaluronic acid. We take the blood in here, and then this goes into the tube, and once it is centrifuged, the gel comes up, pushes the red blood cells and the white blood cells down, because those are more inflammatory. They cause inflammation, they cause pain, discomfort. But then you get the platelets on the top, suspended in a fluid called as a plasma. And that is what we want.
Right.
So that is platelet-rich plasma. So platelets suspended in plasma. We take that and we concentrate it a bit, and then we inject it around the urethra, which is the urine pipe opening. Normally what happens is you've got 2 types of incontinence, the stress incontinence and the urge incontinence. If you imagine this as a bladder and this as a urine pipe, sometimes when there is laxity of this urine pipe, you get a connection like that. And when you cough or sneeze, instead of every time you cough or sneeze, instead of it closing itself, it kind of opens itself, and that's when you leak urine. So tightening this bit of the urine pipe by the laser has helped and try and re-establish this bit, which has made it better. But the urge incontinence is when you leak urine when you're about to go to a toilet or get up in the morning and you're in a rush and you can't get there and you leak urine. That is due to various mechanisms. A lot of it is because of sphincter capacity of the sphincter not to hold the urine, and also overactivity of the muscle itself.
Okay.
For the overactivity of the muscles, we have various types of tablets we can use, but to make the sphincter better, we can inject PRP and hyaluronic acid to make the urine pipe a lot stronger so it holds the urine in place. Okay. Now, what we do is once we have the platelets and the hyaluronic acid, we inject it along the urine pipe. So if this is a urine pipe, we inject it around and next to the urine pipe as well to try and support it a bit better.
Okay.
Okay. Now, as you understand, this is a very new technique. There's not lots of studies published, but we have done lots of patients and we have found huge benefits. Now, the only thing with this technique is there is no harm, because it's your own platelets, your own plasma, and hyaluronic acid, which is one of the safest components manufactured, is the same hyaluronic acid you apply on the face. It's very simple, but this is obviously sterile.